medcram.com.
The next question is from Board Vitals, the USMLE Step 1 Bank and Comlex Level 1 Bank of questions. Now, Board Vitals is a comprehensive medical board review, and we're proud to be partnering with them at medcram.com. So the question is, the patient has no direct or consensual corneal reflex on the right. The lesion is most likely at the level of the right temporal branch of the facial nerve, B, the left zygomatic branch of the facial nerve, C, the right nasociliary branch of the trigeminal nerve, D, the left facial motor nucleus, or E, finally, the right trigeminal nucleus. So let's go over this and try to come up with what they're trying to test you here. Okay, so what I've done is, and this looks a little complicated, but let me explain it. We've got the cornea on the right here at the top, and we've got the cornea at the left here at the top, and everything in medicine is always flipped around, so I'd like to present it this way. When you're looking at the human body, things on the right are actually on the left side of the screen, and things on the left are on the right side, of course. So what we're doing here is we're looking at this reflex. So let's take this through specifically the different types. Now, you've got to understand what the difference is between direct and consensual. Since you have two eyes, the cornea reflex is where you actually touch the cornea with a very, very light tip of a Q-tip or a piece of cotton. And when you touch it on the, for instance, on the right side, if the right eyelid closes, that's called a direct response. If the left closes, that's called a consensual response. So let's go through a typical procedure here where we actually take the cotton swab and touch it to the right cornea. What would happen here is we would touch the cornea and we would get a response to that, and that would be picked up by the sensory nerve here in yellow. Now, the reason why I have this in yellow is it corresponds to the answer choices, which happens to be the nasociliary branch of the trigeminal 1 nerve. And that is this little dot here represents the nucleus of that nerve. So it gets picked up and it goes into this body here, which is the trigeminal nucleus, okay? And then what happens here is very important. Not only does it continue back in the arc to the eye and to the orbicularis oculi muscles, on the ipsilateral side, it also gets transmitted, and this is very important, it gets transmitted to the other side. Why would it do this? Well, if something is getting into one eye and you need that eye to close, you're probably going to have the other eye close as well to make sure that something doesn't get into that, and you're not waiting for a response to hit that cornea on that side. So this is kind of a defense mechanism where both eyes are going to close if just one cornea is stimulated. So these are interneurons. Now, what do these interneurons connect to? The interneuron from the trigeminal nucleus on the right connects to bilateral facial motor nuclei on the right and on the left, both. Both of these nuclei have bodies which come out of it, which are nerves, which are part of both the temporal and the zygomatic branches of the facial nerve, which is a motor nerve. That's why I have this here, this M. So we have sensory up top, and we've got motor on the bottom. So let's go through this. We have a stimulation of the cornea, which stimulates the nasociliary branch of V1, or the trigeminal 1 branch. It goes in, hits the trigeminal nucleus. It then splits to the contralateral interneuron and goes to the contralateral facial motor nucleus and to the ipsilateral motor nucleus. And at that point, it then goes straight down on both sides, hitting both orbicularis muscles on the right and on the left. And of course, the same thing happens on the other side. If I were to do it on the left, you would have both eyes closed for the same reason. So in other words, if we're looking specifically at the orbicularis R, which remember has no direct or consensual, that means that we're stimulating the right side and it's not contracting, and we're stimulating the left side and it's not contracting. So already you can see here that because there's a crossover, you can see there's a dichotomy that's been set up. If both eyes act the same, regardless of which side you're putting it on, then there has to be something wrong in the sensory area. The sensory area meaning that there's a problem here or here or here or here. If, on the other hand, one eye always seems to work or one eye always doesn't seem to work, that's got to be in the motor section. So the reason why I have these different colors is because A is a problem with the temporal branch of the facial nerve. And so I have answer choice A in red. And here you can see the A is right temporal branch of the facial nerve. Let's go down through the other ones. B is going to be the zygomatic branch of the facial nerve, but it is on the left. C is the right nasociliary branch of V1. I have that in yellow here. And D, in green, is a lesion in the left facial motor nucleus. Finally, E is the lesion in the trigeminal nucleus on the right-hand side. So let's go through these, and we'll work on them backwards. Let's first take option E. If there was a lesion here at the right-sided trigeminal nucleus, that would mean that if there was a stimulation of the right cornea, basically what would happen is it would stop right here, and you would get no response in either eye when you stimulated the right cornea. However, if you stimulated the left cornea, you would get a response in both eyes since it's not going through the lesion. Here again, you have a situation where either both eyes are working or both eyes are not working, and that would tell you that it's a sensory issue, which we know because the trigeminal nucleus is predominantly a sensory nuclei. So E is wrong because that's not consistent with what we're actually seeing in the patient, which is no direct and no consensual response only on the right-hand side. Let's go to D. D's issue is that there is a lesion in the left facial motor nucleus. What would happen? If we stimulated the right cornea, things would go through beautifully on the right eye, but it would finally get over on the crossing contralateral interneuron, come to this one, and you would have nothing on the left-hand side. Okay? Similarly, if we were to go to the left cornea, this would come down and go across without a problem, but again, you would have the same problem on the left-hand side. So in other words, one eye is always working and one eye is always not working. And so when you have that kind of a dichotomy, you have a motor problem. And in this case, it's the facial motor nucleus. Let's go to C. C would be a problem with the right nasociliary branch of V1. If we stimulated the cornea on the right, nothing would happen on either side because the lesion is here. If we stimulated the cornea on the left, everything would work fine. Again, we have a situation where everything is either working fine or not working at all. That would be a sensory, and in this situation, it would be consistent with that. However, these cannot be the answer choices because, again, we're supposed to be looking for something where the right doesn't work on either direct or consensual stimulation. So let's go to B. B would be a situation here where this facial nerve, either the temporal or the zygomatic, and specifically B was the zygomatic, is not working. That obviously is not consistent with what the problem is in the stem, but again, what would happen? If we stimulated the right cornea, it would go through here and all the way through, and you would have contraction of the right eye and the orbicularis oculi. However, when it would cross over and go here, there would be no output from the facial nerve. And so once again, regardless of whether it would be consensual or direct, the left orbicularis ori would not contract. Finally, we get to the answer A, which is the correct answer, as you probably have imagined by now, and that is this. The right facial nerve, specifically the right facial temporal branch of the facial nerve, is not working, and that would be consistent with no direct. In other words, we stimulate the same side cornea, and it goes through, but it cannot go through, and so there is no response. Or consensual, if we go to the left cornea, and we stimulate it, and it goes down, it will stimulate the left side, but when it crosses over on the interneuron to come over here to this side, it will not stimulate the orbicularis on the right. And so the correct answer here is A. There is no direct and no consensual response if you have a lesion in the right facial nerve, specifically, in this case, the temporal branch. Thank you for joining us.